green, and including the countries in blue who are covering a higher proportion of salaries in their social protection system. We know that this is very uneven. And one of the things that we discussed at UNDP is that while Germany might have a work furlough system that pays 70% of wages while people are away, and while the United States might have an employment insurance system that sends a $600 check every week to people who have lost a job, most countries in the world don't have formal jobs. We have informal jobs. We're self-employed. We work on the streets. It's not attached to social protection. In fact, not attached to any benefits. So that's the reality of most countries and of most workers around the world. So what we need to do is think of, okay, how do we address that problem? Because clearly there's an issue for the duration of the crisis. So what we came up with is focusing on 3 proposals that are incremental in their nature. The first one is a top-up of existing social protection systems, because all countries, or almost all countries, do have existing cash transfer systems. So there's a potential to top up to whatever that sample is, to whatever that target population is. In many countries that I've been working in, there are dozens of these programs, so that they have different eligibility criteria, they have different target or vulnerable populations, and they have different amounts that are transferred. So in the top-up strategy, what we think of is, let's say that we would like to top up to a threshold of $3.20 for countries that have a $1.90 poverty line. So let's say a household or a person actually has a $1 income that's verified by registries. If we know that, then the top up will be $2.20. So it's the difference between what the registry says, the administrative registry says, and what we can top up. As you can quickly realize, this is very limited because the coverage of existing social protection programs tends to be quite limited in most countries in the world. So we still have the issue of those who are left out. But even for those who are inside the social protection program, it's hard to figure out what market income is. What is it that we need to transfer? So the next 2 proposals have to do with that scenario. And we call it a lump sum scenario. Lump sum means we don't know what the market income is for people in a certain village, in a certain community. So we have to guess, and we'll provide a full lump sum equivalent to the TBI. So if the TBI will be $3.20, then the lump sum will be $3.20. We can think about it in 2 varieties. One is thinking about the cost or the per capita income or consumption in each country. So countries that are more expensive, if you will receive a larger lump sum equivalent. Countries that have a basket of goods that is cheaper with respect to the dollar will have a lower amount. The final proposal is to have a uniform cash transfer. So we always simulate that as well. And we set that at $5.50 for the whole world, for all people under the poverty line or vulnerability line. So what does this look like when we think about the numbers? And of course, one of the important constraints is fiscal. So we have to dive straight into that and see how much these things cost. So we do a simulation for 132 countries with available data. And we find that the top-up strategy is of course the cheapest. The lump sum strategy is the more expensive. But even the top-up is quite big. So it's $199 billion per month in this case. We simulate these transfers for 3 months or for 6 months, as most governments are already using that strategy right now. The second option, the half median income or consumption, is delivering half of what the median income is to each individual. So that's about 257 billion per month. And finally, the most expensive option, of course, is a uniform $5.50 a day around the world, $465 billion for each month. Now, what does this mean in terms of GDP and in terms of efforts of countries during the crisis? So the full amount is about 1.6% of GDP for a 6-month TBI. This is the GDP of the developing world. If we look at all of the world, if we look at the whole world's GDP, it's about 0.9% of GDP. As you know, we're living through an incredible moment in which many fiscal windows are opening, and we find that the fiscal stimulus package in Europe, for example, averages about 10% of GDP. The fiscal stimulus packages in middle-income countries are averaging about 4% right now. And the stimulus packages in low-income countries are averaging about 1.6% of GDP right now. So we know that there's a lot of effort happening, and we know that it would take more of that effort to cover everyone with a basic income. And I'll talk about some strategies later on, but this is the size of it. It's about also equivalent to 12% of what the G20 countries are using during the COVID response, or equivalent to 1/3 of what developing countries will be paying on debt service this year. As you know, debt service is $3.1 trillion this year, out of a stock of 11 trillion for all developing and emerging economies. This is a quick look at the regional coverage. So you'll see this reflects the state of where different poverty lines are. I should have mentioned at the very beginning that we're using various poverty lines. So we look at the $1.90 poverty line and set a TBI of 320 for those. The proposal is to cover poor and near poor households. For countries who have a $3.20 poverty line or close, the TBI is $5.50. And for countries that have a higher poverty line, some in Latin America, $13 a day is the TBI. So equivalent to each region's or each country's specificities. We've run a simulation. Of course, this is an academic simulation for Pakistan. The beneficiaries for a $3.20 day TBI would be about 51 million people. The per beneficiary monthly top up would be about $18, given market income captured through registries, or it would be $66 if it was a lump sum, if we didn't know the incomes in different communities, districts, states. The monthly cost for this would be about 0.08% of GDP. Multiply this by 6, which is a 6-month TBI assistance, and it's still, it's a large amount. It's 0.05% of GDP, but it is within reach, we think, for some of the largest emerging economies around the world. So you can take a look at the annex, and we've done the exercise for all countries, China, India, Brazil, Mexico, all the large economies and all the smaller economies. And as you can predict, for some of the smaller economies, especially the small island developing states, the amount is very high in terms of their GDP. So it reaches up to 10 or 15% of GDP for a 6-month TBI. But in the largest economies, it tends to be under 1%. Now, the key question, of course, is implementation. So this is all good. It sounds reasonable, a basic income that's temporary, that supplements incomes during a crisis period, and that allows a bridge to recovery. But what we know is that there are many implementation challenges. The first one is fiscal, and there are other digital implementation, administrative registry, even political challenges. So let me share what we've been learning on the implementation side from countries that we've been working with, and some countries that we haven't been working with, but that are sending some lessons to the world on how to address these implementation challenges. So this is a simple scheme. It's a sort of a 3-stage scheme. As you set up a TBI, they'll be going through an identification enrollment process. And this is a very tricky part because, as we know, existing social protection programs might cover 5% of the population or 10% of the desired population, but you want to reach 90 or 100% of the desired population. So first, we focus on eligibility and look at identification. And this is also tricky. Some countries have very good administrative registries that are geo-referenced. Other countries require the use of proxy means maps based on census data. Other countries use even coarser forms of geographic targeting. So we use all 3 of these, and we focus on the identification first. So first is to know who would be eligible for a TBI. We believe it should be all adults and all children under the poverty line and near the poverty line, brushing up against the vulnerability line. Second of all is the enrollment process, which is also very important. I'll talk about that with a couple of examples. Enrollment means reaching out to people, self-registering them, registering them, checking against national IDs, checking it against biometric proof. And we have some very interesting examples and very interesting ideas happening right now. But then rollout within the first 30 or 60 days, of course, requires at least one of these three forms of payment. Mostly in most countries, it's all three. So the default one is, of course, cash in places in which there are no digital or mobile money services. But the most popular, I would say right now, is the digital payment format that's being used in many countries, that's already been rolled out with existing social protection programs. And some using mobile money, which is currency paid into a mobile from an account set up for that purpose. So we've been using these three: digital, mobile, and cash. Of course, it depends on the challenge at hand. Rural areas, how far away are we from a payment point? How far is mobile connection in a country? And how deep is banking and access to banking accounts in a country. So this is a formidable challenge, but it's one that we've been engaging in over the past few months. And then finally, there's the exit strategy. And this is the graduation. This is important. It will lead either to jobs and SMEs and supply chains and the labor market, or to social insurance in different forms of social protection in the future. Hopefully, this cash transfer, which is a social assistance, should be a one-off, should be a 6-month, should be a 9-month, maybe a 12-month program. But we don't foresee that this would extend into the future. It would have to merge into existing social protection programs. So let me share a couple of examples of what's going out, and I'll do this in a typological way. So what are we learning from countries who have excellent georeference administrative registries? This is the case of Colombia. They rolled out what could be called a TBI because it reaches all poor people through their administrative registry system. They have a real-time data system and layers of data for each municipality in the country. And they can georeference all the way down to the household and layer that household with multiple forms of data. So what they were able to do with that kind of administrative registry system is to expand very quickly and to reach about 2.9 million poor and vulnerable households in a matter of weeks. And they focused, of course, on those who were not covered by existing social protection programs. So this is the additional one. This is the extra that was rolled out in a matter of weeks and months. The benefit is about $44 per month right now. Program fosters financial inclusion with 1 million accounts open. This is mobile money and digital payment money over the past few months. So it's quite an effort, but this is sort of the example coming from a country that has very good administrative registry systems in every municipality. A different case is Togo, that did not have a good administrative registry system, that had very basic system, in fact. And what they did and what we've learned from them is how to expand in record time using mobile self-registration. So the Novici cash transfer program was set up in the month of April. They registered close to 12% of the population in the first weeks of the pandemic, in about 14 days. In the early parts of the pandemic. And now the digital program reaches around 500,000 people in Togo. It requires only an ID and a mobile phone, and the money has been given to retailers and tailors and seamstresses and housewives, and out of beneficiaries, most were women. So this is an interesting program, particularly because it shows a real-time example of how to reach out into rural communities that don't have administrative registries, that we don't really know how to capture with the conventional tools. And then there's the case that we're working on these weeks, and I'm personally involved in this and working with the authorities in Lebanon after the blast a few weeks ago. And we're preparing an emergency TBI program for Lebanon focused on Beirut, but also reaching out to all populations that are poor and vulnerable in the country. As you know, the situation was dire in terms of economic and social hardship over the past 18 months. So the blast only magnified that effect. The simulations that we're doing cover between everyone under the $13 a day, because Lebanon is an upper middle income country, the $13 a day threshold. So that's about 23% of the population. And then we focus on different scenarios of transferring $5.50 a day, 13 a day, top-up approach, and so on for 6, 9, and 12 months. And you can get sort of a sense of what the fiscal cost is and what the scenarios are. This isn't public yet, but we're working with the authorities, and we'll be looking into the implementation challenge, which is perhaps the biggest one there. Let me focus on the last part, which is graduation and beyond. I'll come back to the fiscal side at the end, but I think more pressing than the fiscal issue is how to deal with the exit. What is the graduation? How do we merge out of that? And I think there's a lot of lessons learned in the past. My own sense is that the hardest development challenges are what I call cactus in the desert problems. And cactus in the desert means that we usually adapt our solutions to the existing environment, which is fine, but then that means that we can never go beyond the desert. We never change the incentives that got us stuck in the first place. So we need to create an oasis, I think, and that means expanding the jobs and the SMEs and the supply chains and the ecosystem to create jobs. So that's the cactus in the desert problem. As you know, there are multiple graduation pathways, and there's a fantastic literature on this. Some focus mostly on graduation, building up assets and savings of the poorest and the ultra poor. And there's some very good examples. You can think about BRAC in Bangladesh. You can think about what the International Poverty Action Group is doing with their monitoring and evaluation programs. Other programs have focused mostly on human skills, and human capital and skills and training, linking this to labor markets, particularly to migrants moving from rural to urban areas. And finally, there's many multidimensional graduation schemes like the scheme you're seeing on your screen right now, a graduation model that has many components, livelihoods and assets, skills training, a safety net that it might include a cash transfer, savings, promotion, coaching, health, and of course, I guess one of the most important things here is behavioral change, the fact that many of these issues are not actually about the money, they're about changes in behavior over the long run and the incentives and institutions and even the politics of local service provision. As we think beyond transfers, we eventually come to the issue of a social protection architecture. It wouldn't be feasible to have a scheme after scheme to address the crisis after crisis. So the social protection architecture usually focuses both on social assistance and social insurance. We've been learning that it's very important to put jobs and livelihoods at the center of that architecture, even though we usually think of jobs and livelihoods in the Ministry of Economy or Production. We think of it as a thing that economists and macroeconomists focus on, but jobs are at the center of the social protection focus, we believe. There's a lot to be learned from contributory social insurance programs of different types for old pensioners, for people who get affected by drought or by crises such as a pandemic. And as you know, there are many social assistance programs that use cash and non-cash transfers. I think it's important to move beyond income, to think about well-being as a multidimensional issue, to think about time use, to think about gender considerations, to think about pre-existing inequalities, exclusions, discrimination. And all of those transcend income. They have to do with society, they have to do with culture, they have to do with local reality. So I just wanted to end with this map because this is work that we've been doing in many countries around the world. We call this a project, it's called Sdg Hot Spots, which is to think of this challenge of poverty, inequality, and also all economic and social issues in a geographic frame, thinking about a district, thinking about a rural community. All of our districts have a map like this, in which you have some parts of the population in the green, some that have some disparities, and some in the red that have multiple overlapping deprivation. And when you find hotspots that are in the red that have 20, 30, 40 deprivations that cover poverty, services, income, gender disparities, and so on, you know that these are the hardest development problems. And you know that these are not solved just by a service or by an income, but by thinking again about what is it that creates this low-level equilibrium trap, if you will. What is it that doesn't make sustainable development viable in these regions? Some, frankly, have to do with climate change, with drought, with where our populations are located with respect to a different moment in our climatic history, if you will. And some have to do with existing demographic change around our country. So I just wanted to leave you with this last one. Reiterate the issue that we don't see this, the TBI, as a silver bullet, but rather as an emergency measure that can be bridged into a more comprehensive view of how to address the hardest problems, how to address the Sdg hot spots, intersections of multiple Sdg gaps, exclusions, and deprivations. I invite all of you to take a look at the report that we put out about 4 weeks ago. We'll be having a follow-up on this, on implementation challenges specifically, and a follow-up on debt issues and on fiscal issues, because I know those are of great concern and are part of our discussion with authorities in many parts of the world. Let me stop here. Thank you all. And of course, I'm very happy to address comments and questions as we move along. Over to you, Sean. Thank you so much.
Thank you, George, for yet a very interesting and informative, thought-provoking session on TBI, its implementation challenges in comparative economies, and the idea of linking TBI with social insurance and social assistance programs was particularly interesting. Thank you indeed. And I would now request Dr. Sania Nishtar to tell a little bit about Pakistan's government response to the pandemic, the SARS program as well, and maybe highlight a few challenges as well. The floor is yours, Dr. Sania.
Hello and good day. Can you hear me?
Yes, we can hear you.
Okay. Well, first of all, thank you very much for asking me to join you. It's fascinating to hear George here about the recent report, which I'm really looking forward to reading. And it resonates with our Pakistan experience at so many different levels. Basically, we in the context of COVID, we ran an emergency cash program for a very large segment of our population. And there's a very rich implementation experience that we've gained based on that. So I just want to share a little bit about that. And then I will try to pull the common threads between George's presentation and our experience back here in Pakistan. So to put things in perspective, when COVID struck, governments like ours were walking a very tightrope. Our government in particular, because in our country of 200 million people, we are the 5th largest population in the world. There, according to microanalysis of our labor force survey, there are 24 million breadwinners who either subsist on daily wages or on piece rate remuneration, or are self-employed at the bottom of the pyramid in Pakistan's very large informal economy. 24 million breadwinners, I want to re-emphasize. And if you multiply this with family size, you're basically looking at 2/3 of the country's population subsisting in this very informal ecosystem. So our government was very conscious that with the lockdowns, even if they were selective, they would be with this very large segment of the population that would basically have to forego their income, and that is exactly what the case was. So about 10 weeks into the lockdown, which was to begin with a bit strict, and later on we converted to a smart lockdown, there was immense tension within the country. The country was at the brink of individuals coming out on the street and rioting. And I recall many individuals calling up and telling me that they wanted to distribute rations and had packets of rations in their car, wanted to go out and stop their car somewhere, speak to all the daily wagers and distribute rations as a goodwill gesture, because as you know, in Pakistan, there's a very strong spirit of philanthropy. And a lot of people would call me and tell me their cars were attacked because there were so many hungry breadwinners out on the street. So it was a very precarious situation. And to respond to this challenge, the government created what was called Asas Emergency Cash. Asas is the name of the government of Pakistan's social protection and poverty alleviation program, which was launched 15 months ago. And because we were executing this under the umbrella of the overarching program, we call it Asas Emergency Cash. Asas, by the way, in Urdu language means compassion. The emergency cash program which we launched was undeniably the largest social protection program ever launched in the history of the country. It was rolled out within 10 days of the lockdown. We got a mandate to reach out to 16.9 million families. 1.2 billion US dollars were allocated for this program. And we were meant to deliver one-time emergency cash grants amounting to 75 US dollars. So with 16.9 million families, we were almost covering 50% of the country's population. Before I tell you a little bit about Asas Emergency Cash, I just want to spend maybe 30 seconds to let you know a little bit about Asas. Basically, Asas is a vision about creating a welfare state, but by using 21st century tools. The use of data and technology to create precision safety nets as part of this approach. Use of financial inclusion as a tool for poverty graduation is part of this approach. Empowerment of women is central to the Asas agenda. A focus on human capital formation is a very salient pillar of Asas. We focus on overcoming financial barriers to accessing health and education, tackling malnutrition in all its forms, and most importantly, employing multi-sectoral and multi-stakeholder approaches to develop solutions at scale. And the program's premise is also grounded in the importance of strengthening the institutions and a focus on transparency and good governance. So basically, because of the heavy emphasis on 21st century tools, for lack of a better expression, and the emphasis on the use of data and technology, we had invested in a number of different institutional backbones over the last 15 months, which is why the rollout of Asas Emergency Cash became so successful. The digital capabilities that we leveraged were, number one, a new biometric payment system that we had deployed in 2019. Through a competitive procurement system, 2 commercial banks were brought on board. And the payment system that we had developed had the approval of our central bank, and it included a limited mandate current account and a savings wallet. So that was one of the pillars that we leveraged. The other digital pillar that we leveraged was an SMS-based self-registration system in the social protection ecosystem. And the third digital capability that we leveraged was a data analytics mechanism, which was developed. And in fact, in December of 2019, we had exited 820,000 false claimants from Pakistan's social protection lists, because Pakistan has the national identification system. It's a 16-digit number which every citizen has, and that unique identifier allows us to triangulate varied personal information using the national identities as the peg, and then to use this with the wealth profiling system. So what I'm trying to to convey is that over 2019, we had developed these 3 digital pillars, and we were able to mesh them together, knit them together, to run the backbone on which SARS emergency cash was run. 16.9 million families, 109 million individuals, virtually half of the country, of this 5th largest country in the world, and 1.23 billion US dollars as the budget. This is just repeating myself. So in terms of targeting, we adopted a hybrid targeting approach. We combined emergency cash assistance for the known vulnerable with demand-based support for the new poor. And then we sought requests through an SMS short code service. And we, of course, also opened a web portal, but the majority of the requests came in through the SMS short code service. And we extensively advertised in local language. We mobilized all the actors on ground, and we got 139 million requests. So when we cleaned data, we had 66 million unique SMS requests. We then used data analytics to enable eligibility ascertainment using the unique national identification numbers. And we also drew on our geo-referenced survey data and wealth proxies. The reason why we were not able to completely rely on our survey data was because the database was 10 years old. It had less than 80% coverage to begin with. And so a number of people were not within the ambit of the survey. And in any case, it was 10 years old. So, which is why we had to rely on wealth proxies as well. And after eligibility ascertainment, then payments were biometrically verified. So the system was end-to-end data-driven, it was fully automated, it was rule-based, it was transparent, and it was politically neutral. So it was quite unprecedented for a country like ours, where emergency cash payments inevitably get into a very ugly tangle with accountability mechanisms, that the largest social protection program was run without anyone lifting a finger. And even the government's the most bitter political opponents had to accept that this was run in the most transparent manner possible, in a rule-based manner, and it was totally apolitical because one of the 4 provinces, as you know, Pakistan is a federating system, and one of the 4 provinces is ruled by another political party than the one which forms the government at the center. And that province got the largest share of SARS emergency cash. The impact of this program on ground was the most impactful thing I have seen in my entire career, because I toured the country extensively. Our Prime Minister was in the field a lot with us during those days. And we met in, our payments were made in very large campsites, because we were making these payments when there was a lockdown in effect. So we couldn't use the retail outlet and the ATMs in banks as much as our reliance on special campsites, because we would get special permission from provincial governments to set up those camps. We would move retailers there. And then we would gather people there, ensure that all the public health measures were being complied with, and then we would make payments in those special settings. So there we would meet daily wage laborers who had been without work for weeks. We'd meet staff from otherwise busy hotels and restaurants who had been sitting at home not knowing how to pay house rent or bills. There were servants, part-time gardeners, security guards, drivers, industrial daily wagers who had been laid off by the employers. Depending on the geography, there were fishermen and miners who, whose work settings had certainly vanished. During these visits, I met transport contractors, bus drivers, hawkers, beauticians, shopkeepers, teachers in private schools who had been laid off, skilled laborers. There were electricians, welders, painters, carpenters, plumbers, car mechanics, construction labor, taxi drivers. They were basically all out in the cold. And this story was repeated across industries and geographies. And it was not just them. This actually had a negative domino effect because the employees were themselves being laid off. So even those who were used to earning a decent living were suddenly wondering if their balance sheets would ever square again. So the $75 brought these families stability and comfort. And it was a very moving experience, and the whole nation watched as millions of tragedies were averted. So administratively and from a governance and institutional standpoint, I'd say that this was quite a watershed moment for us as a government, because to the extent of SRs and to the extent of my ministry, I can tell you that it has changed the way we will work in the future. It made the government more agile, more data-driven, more experimental, and even more ambitious. And it actually helped us with the fast-track adoption of cost-effective and digital ways of working. And it also forced us to embrace new ways of coordinating across multiple stakeholders and deploying a whole of government approach that we talk about, that we've been talking about endlessly. I mean, I've worked in the UN system a lot, where we talked about the whole of government approach and how important multi-sectoral action was. But to see this actually playing out in the field, and the power of that was very powerful and extremely useful. So about 2 weeks ago, we put out a report which I authored, and the report is about number one, sharing the whole methodology side of the story, what was done, how it was done, how we targeted, what the results were, how we ascertained eligibility, or what were the modalities of the payment system. And then the report is also an account of how we embedded real-time evaluation into the program, and what the lessons learned were, and how we encountered them. Moving forward, impact evaluations have been commissioned, and results from that will be available very soon. More broadly, we are redefining the prevalence of poverty and vulnerability in the country. There's an ongoing policy discourse on the horizontal and vertical scale of social protection post-COVID. But the legacy of this program is not short-term relief. We built longer-term goals to strengthen safety nets and increase financial inclusion into its design. And I believe that both of these will bring lasting benefits to recipients and in fact, the country as a whole. So this experience has basically taught us how to deploy a very large program in a context of uncertainty with speed, when changes were being made in real time. And one of the motivations for doing the report was to share this story with the global audience, because our report essentially tells us, I beg your pardon, the experience essentially tells us that if a country has a unique number, whether it is in the form of a national ID or a social security number or whatever that number is, then there are ways to combine it with cell phone pervasiveness, the ubiquitous presence of internet connectivity, And it's possible to create a demand-based social protection system to reach out to those in distress at the time of a crisis. And it's actually possible to institutionalize it beyond that. So as I said earlier, for us, this is not just emergency cash, because we were 15 months into building a much larger program for which a number of different institutional building blocks had already been laid. So after the SR strategy was unveiled, sometimes around April or May last year, the SR's ministry was created. The largest budget in the history of the country was allocated. The strategy formulation, the implementation plans, the monitoring and evaluation, the whole metrics at the outcome level, the detailing at the process level, the structuring of the mutually reinforcing programs, the digital architecture that I talked about, the wide-ranging governance reforms of institutions which we envisaged then would allow us to deploy with integrity. This whole ecosystem was being built for the last 15 months. And then COVID struck. And we were able to pull these 3 digital threads from that institutional ecosystem and mesh together what allowed us to deliver SaaS emergency cash. But this is a long-winded way to tell you that there are plans to upscale this. And post-COVID, the need to do this has in fact augmented manyfold. So we are very conscious that that in the era of the MD, I mean, let me finish on a UN relevant note. And I think that I'd like to say in the end that with regard to the MDGs, the poverty eradication metric was achieved 5 years ahead of schedule, but with the corresponding SDG, we are sadly moving backwards, which is why we are very conscious in Pakistan, where 2/3 of the population is works in the informal sector and subsists on activity in the informal sector at the bottom of the pyramid. We are very conscious that an emphasis on social protection has to be a very real emphasis, and we need to deliver very quickly. And therefore, SaaS emergency cash will allow us to be a stepping stone towards that goal. We know that universal temporary income is more cyclical than the one of emergency cash. And we are currently analyzing and exploring whether we need more cycles. But beyond that, we are basically planning for how we're going to structure a stronger social protection system after this experience. So I'm just going to stop here and hand it back to you for any questions that you might have. And I just want to thank you once again.
Thank you, Dr. Sania, for another enlightening session. It is indeed commendable to be able to bring a human lens to statistics. Not all economists and professionals are able to see the lost lives behind the regressions and real people behind statistics. I think the emergency cash program is indeed a success story and should be highlighted at the global level for other countries to learn as well. And we are proud to have you. And now I think we'll, without further delay, we are going to move to the last segment of today's session, which is the Q&A session. My first question is for George. And obviously, I think you've heard this before as well. In very simple terms, how do you pay for it? Often people answer this by saying that we pay this by raising taxes. But then there's a growing movement of economists who claim that modern monetary theory could be the answer. This would involve governments creating new money through fiscal policy and would then be distributed to people in the form of basic income. But what is your opinion on it? How do you create the fiscal space? And how would this actually work? George.
Thank you so much. Thank you, Shad. I think this is an important question. I think the answer is to think of two horizons, the short term and the medium and long term. The short term, of course, is the emergency situation we're in. So most countries have no option other than to repurpose existing expenditures. So that's what we're seeing around the world. We don't recommend raising taxes for the purpose of a temporary basic income, because it's a cyclical issue, it's a shock. We hope that once the shock is over, we resume to build up, robust social protection systems that are based on both contributory streams, which are employers and employees contributing into a fund or a contributory pension or an unemployment insurance scheme, or taxation used for social assistance. So that's the short term. Unfortunately, I wish there was a silver bullet as well, but there isn't. So what we've seen right now is repurposing of fiscal resources on a grand scale, as we just heard by Dr. Nishtar, and I think that was a fantastic presentation, and I took a lot of notes about the Pakistan experience, because what she described was exactly the hard choices to be made, reaching out to millions of people, repurposing vast amounts of fiscal resources. And of course, there's a pecking order. You focus first on health, on the essential services like food and medicine. But then right there, maybe number 3 on that list is incomes of the poorest and vulnerable, and the day wagers and the informal workers that have no other option. So I think that's what we're seeing in the short term. In the long term, of course, there's the chicken and egg question, because what we want is to expand the tax base that is broad-based taxation. But what is the incentive for that? Moving from informality to formality. Some countries that I've been following, particularly in Latin America, are thinking of something more futuristic, which is sort of based on the idea of negative income taxes. So that would work the following way. For the first 5 years or 10 years, you register into the tax system, but you don't actually pay taxes because you're under the poverty line, you're under the vulnerability line, but you're registered. And as your income changes over time, you cross the threshold, and then you start paying taxes maybe in 5 years' time, or whenever you've crossed the threshold. So this is an old idea. This comes from, creating a universal basic income, but inside the tax system, if you will. So I think there's something to be said about that. At the end of the day, what you want to see is a net progressive story for all taxes, subsidies, and transfers. So I think that combination and the political economy of those 3 is quite complex in each country. But that's where the state of the art is right now. Over.
Okay, thank you, George. So while I am conscious about time, we initially, agreed that we'll finish it in 1 hour, but I'm going to, with the permission of the panelists, extend it for another 5 to 10 minutes, because we have very interesting questions lined up. My next question is for Dr. Sania. And we know that you've created a critical mass of mobile wallet users who are the beneficiaries of BISP and SAS program. But now, how do you see this will move to the next generation of wallet experience, including services like social insurance and savings and loans? Do you see that they will be embarking to that journey, and how will you improve the user experience for them? Because I think as of now, they're only using wallets for cashing out.
Yes, that's a very good question. So basically, I think what we've done with these 16.9 million individuals is that we have basically familiarized them with the banking system, in the sense that they have gone through a basic KYC, know your customer checks. So they have come into the banking system at a very basic level. Number 2, they've gotten used to the cash in, cash out operations, because that is also new, because people are used to getting money at their doorstep through postmen, and with the pilferages that come alongside that. So at a very massive scale, individuals have now developed the confidence in the banking system. They go to retail, the banking retail agents, and through a biometric signature, they're able to withdraw their money. So that's the first step, the KYC checks and the confidence. And we know through, literature surveys tell us, and CGAP has done a very interesting meta-analysis, which basically shows us that the cash in, cash out operations are a stepping stone towards financial inclusion. But going forward, in order to get them to use their wallets and not just the limited mandate current accounts,
Right.
because they will have the option to push the money into the savings wallet after the biometric signature and not just withdraw it. In order to promote that, we are now investing in financial literacy. So they have to, number one, understand how this is done. Number two, how to use money in those wallets for digital transactions rather than using cash. So that's the next step for us. And we're working very closely with our partner banks to make the necessary investments, not just in the financial literacy interventions that are needed to promote this, but also to develop the products that will be useful at the bottom of the pyramid. So that's very much part of the plan going forward.
Perfect, thank you. There's another question by Rafiq Mustafa Sheikh, who's an official of the Sindh government. And he says, no matter how robust the social protection, social safety net programs in governments evolve, exclusions of eligible beneficiaries is there. How do you minimize exclusion? What percentage of exclusion is acceptable in a very robust social protection system? Secondly, he says how to minimize inclusion of non-eligible beneficiaries in such models. This is also for Dr. Sania. Yeah.
Well, there's a certain amount of inclusion and exclusion error, which is always permissible in any social protection program. But you would know that for emergency assistance, for emergency humanitarian assistance, you have to raise your bar. So our starting point was that we should try and minimize exclusions in line with best practice. And I think that the methodology that we adopted allowed us to target fairly well, but of course independent evaluations are now ongoing to get us a very specific answer on that.
Okay, thank you. We'll take two more questions and then we will wind up. Let me just select the best few. It says, going forward, can females be motivated to receive TBI transfers while also being encouraged to get themselves tested for COVID-19? I don't know what it means. Okay, then she says, he says, can this gender inequality be reduced by using a system of conditional TBI handouts, which encourages female TBI recipients to get tested for COVID-19? I think it's related to people who are testing positive and then linking it with TBI. George, if you can take this.
Certainly, yes. I think that's an important question. I think what we've learned from a number of countries is that as we focus on informal sector workers, on self-employed workers, we should not forget unpaid care work, which actually makes up a vast proportion of all work as we do the tables and we prepare the volume of assistance. An interesting case in point is Argentina, that focused its cash transfer program about 8 years ago only on women and focused precisely on those who didn't have a pension because they weren't tied to formal sector jobs. And that program has grown and has become one of the most successful programs in creating an equal floor, if you will, during the pension. But it's also brought in the discussion about how about, during the labor force, what can we do when women are active between the ages of 15 and 65, if you will. So I think that the TBI and the whole UBI discussion is actually addressing a lot of that, because if you look at just the clear statistics, most of that is going to actually supplement for what unpaid care work or even domestic work is being paid out. But there's a lot to be said about linking this to care systems, and systems of care, of course, funded by public resources. They create an incentive for women to step in to a formal labor force and to have the support needed for care for children or for adults. But I would like to end by saying that this, of course, is men's responsibility as well. It's a gender equality idea of thinking about the care economy, thinking about how we work through unpaid labor and linking that to a future job income stream in the future. But I would just stop at that. I think that the Latin American experience, the Argentinian experience in particular, is very interesting.
Thank you, George.
Thank you as well.
Yes, please.
So basically, Pakistan's cash transfer, unconditional cash transfer interventions are also exclusively women-centric. So currently 5 million women are in our unconditional cash transfer program, and by the end of this year, this is going to be increased to 7 million. And then through other SRS initiatives, these women become preferential recipients of the benefits of other programs. For instance, in the interest-free loan program, there are no markups for small business loans that these women beneficiaries take. For instance, in the SRS asset transfer program, these women, it's mandatory for that program to have 60% of these women from this ecosystem as recipients. So there are examples, of course, outside of Argentina, of very large social protection programs which are exclusively women-centric, and in our case, we are linking them very creatively with other benefits that the government provides as well. The other part of the comment was about conditionality and how COVID factors into that. So there are health conditional cash transfer programs, and we ourselves are running those, and there are education conditional cash transfer programs, and again, these are a part of our ecosystem as well. The question of whether a COVID check can become a conditionality is something that no one has implemented as yet as part of the cash transfer ecosystem. But other than a conditionality, there is also another policy instrument of a labeled cash transfer. So there is nothing stopping us from labeling our unconditional cash transfers with messages that are COVID-centric. And those might center on the public health preventive aspect, or or testing as is recommended in an evidence-based manner. And I think that we, in our emergency cash operations, inadvertently did this to a very large extent. So when I did my daily radio show at the peak of the pandemic in our country, when emergency cash was being rolled out, I was simultaneously making a call for all the public health measures that were mandatory and which the government was promoting, and also creating awareness about the specific inflection points or the indications for testing. And I would say that was an example of how you labeled emergency cash with another condition. And so I was thinking that, so I would say that the lines kind of blur at that point. So we did label our cash transfers at that point with something that was that drove right at the heart of the COVID preventive measures.
Thank you, Dr. Sania. Thank you, George. My last question is for George. It's a very brief one. Is there any global experience on monitoring and documenting the impact of TBI program? Or is it just a recent phenomena and maybe more longitudinal studies will be available in the future? This is by Umar Malik.
Thank you so much. Yeah, this is something that we're actually interested in UNDP. So we're pulling together a policy tracker to focus on TBIs and to evaluate how they evolve during and after the pandemic. So, but of course, the results of that are we'll probably only see them in 12 or 18 months as we see, you know, the wave and changes over the epidemic. But it's something of our interest because we see this as a critical instrument in the toolkit during the pandemic.
Perfect. Thank you, George. And again, I'm conscious of time. People have other commitments as well. And I'm sorry we weren't able to take all the questions. We were really enjoying the responses from both the panelists, and I wish we had more time. And at least I have learned a lot this evening, and I hope you have too. This has been a fascinating discussion overall. A huge thanks to George and Dr. Sania for joining us this evening. And at the end, I would like to thank all the participants, especially the panelists for taking the time out. Special mention to the interpreter from DevTalk, who made this event inclusive, and my team here in Karachi, especially Sajjad and Rafiq Sheikh Saab, Mumtaz, and everybody in Islamabad as well, Umar. This webinar was recorded, and I will soon share the details to access the recording to your registered emails. Signing off now until we meet again. Once again, thank you very much indeed on behalf of the United Nations Development Program in Pakistan. Have a wonderful weekend. Have a wonderful rest of the day. Thank you very much.
Thank you.
Thank you so much.
Thank you, Allah Hafiz.